Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for a radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also tuning in through our friends at iHeartRadio and Amazon Music Podcasts. We're glad you all could be with us as well. This is part of our News You Can Use segment here at WYAD, and today we're talking about brain cancer. July 20th is recognized as GBM Awareness Day. GBM is the deadliest type of brain cancer, but there are treatment options available for those who are living with it. And because of that, we're excited to welcome our next two guests to our program. We have Ira Bornstein joining us. He's a patient living with GBM. Also, we have Dr. Tobias Walbert, who's the Director of Neuro-Oncology. We're going to talk to the two of them not only about GBM, what you all need to know, but also about a treatment option that maybe you're not aware of that will definitely be available for you all to be able to find out more information about. Thanks to the two of you for the time. Really appreciate it.
Thank you.
Dr. Walbert, I want to start with you before we get into Ira's journey. First of all, for our audience that's just now finding out about GBM, why is it one of those things that is so prevalent when it comes to brain cancer?
Yeah, so glioblastoma or GBM is the most common brain tumor. And it affects about 15,000 patients a year. 15,000 people are newly diagnosed every year. And it is a very, not only the most common, but as well the most aggressive brain tumor. So,
Dr. Walbert, what are some of the symptoms then for those who may be living with or dealing with GBM?
Yeah. So typically what we see is it's all about location. It's like depends which part of the brain is affected, and that defines the symptoms. But we see headaches, we see weakness, we see vision impairment, and so it really depends which part of the brain is affected. And I think the big difference is to a stroke is that these symptoms typically come on in the more over days than rather like a stroke where people wake up or all of a sudden develop these symptoms. So I think that's an important differentiator.
Ira, we appreciate you being on with us. Tell us a little bit about your own personal story and being diagnosed with GBM, if you don't mind.
Sure. I was diagnosed at the end of July 2020 by a MRI. I had intermittent headaches. I felt as if they were going through my right eye. They were not debilitating at all, but this was spread out over the course of several months. Soon after the diagnosis, I had a craniotomy where the 5 centimeter by 5 centimeter tumor was removed from on top of my brain. That was followed by 6 weeks daily of radiation and chemo, about 2 months off, and then I began a regimen of 6 months of chemo, and at the same time I began wearing the Optune device. The Optune device is actually, it's non-invasive. The only issues that I ever have typically are just some, soreness or open sores possibly on my scalp from wearing the device. But other than that, I'm able to do everything I did prior to the diagnosis. So I'm a very active person. My wife and I walk every day 3 to 5 miles. Wow. We hike at elevation. We skied the last 2 years. We've skied over 200,000 vertical feet each year. I work in my yard 4 to 6 hours at a time. We travel. I just returned this weekend from 2 weeks in Iceland, where we hiked at the top of volcanoes into waterfalls. So, it's very adaptable, and you just have to be optimistic, and you can't view this as a death sentence. It's not. It's really a life sentence, and it should, it should invigorate you to keep living your life instead of, just giving up on life, because there's a lot of life still to be lived, and and nobody can tell you when you're going to die. You just have to believe in yourself and what you're doing. And my wife and I have instituted a bunch of things, and Optune is one of many of the things that we've done. And so far, I've been very successful. I'm in a week out 2 years.
Oh, amazing. Ira, thank you so much for sharing that. I want to go back to you then, Dr. Walbert, as we talk about Optune then. What are some other side effects? I know Ira shared a bit of his story. If you don't mind, talk to us about the side effects and exactly how it works.
Yeah. So the typical therapy, as Ira laid out, is like the surgery followed by radiation with the chemotherapy, and then the chemotherapy with the tumor treating fields, or Optune. Optune is a wearable, innovative, FDA-approved device. And so what makes it different than chemotherapy is that it uses a low electric field, and that low electric field is impairing the cancer from growing and coming back. So in that regard, it is very different than the chemotherapy, and that's what makes it a great addition to the chemotherapy, because the side effects are not overlapping. So when we think about chemotherapy, we look at the blood count, sometimes some nausea, these kind of things. But with the Optune device, because it's not a chemotherapy, but a device that patients wear and carry around with them, because of that, it's very complementary to that, and that makes it really great.
Definitely some news our audience can use. Again, everyone, as I mentioned, GBM Awareness Day is July the 20th. Here talking with us about GBM, what it is, and Ira sharing his story and how Optune has helped him. We're excited to welcome Ira Bornstein as well as Dr. Tobias Walbert. You all can find out more information about Optune by going to Optune.com. Again, that website is Optune.com. For those joining us online, we will make sure that we post that for our audience as well. Thanks to the two of you for the time. Really appreciate you dropping by the show today.
Thank you for the opportunity to educate people and hopefully give people hope.
Thank you so much for having us today.
Appreciate that. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live, and let's go make today amazing. Take care.